Okay, so yeah, so as Lori said, I'm a professor at UCSF, professor of medicine, but I'm not a clinician, PhD. So I do research on cardiovascular research. And yeah, Matthew Springer, PhD, but it is definitely Matt. Everyone calls me Matt. So I'm happy to be giving this talk here, and I have to remember not to talk about earthquake stuff and go on autopilot. I did want to mention one thing. So the title of the talk that I was asked to give is the heart health. And when we say heart health, people usually think of the heart, but actually, oh, okay, okay. But actually, in this case, we're really focusing on blood vessels. And so when I say the cardiovascular this or cardiovascular that to most of the people in the public, newspaper people, et cetera, it always gets translated to heart. It's relevant to heart, but specifically, directly, we're studying the effects of smoking, vaping, et cetera, on the blood vessels. And that in turn has impact on heart health. Okay. So we focus mostly on vascular endothelial function. And what that means, the vascular endothelium is the inner lining of the blood vessels. Those cells, the endothelial cells, have several important functions, one of which is that they sense when too much blood is being forced through the vessel. Say the downstream tissue needs more blood, lots of blood trying to get through that artery, and they sense that, and they produce a signal that makes the vessel vasodilate and grow in diameter, and that allows more blood to pass through. This happens in real time, and this is called flow-mediated dilation of the artery. We measure this with ultrasound. I have a little graphic here showing what we do in people. We have a ultrasound like what you have when you're looking at a fetus in a pregnant woman, and we put that on the arm. We have a blood pressure cuff on the forearm, and we cut off the circulation to the forearm with the blood pressure cuff entirely for 5 minutes, which sounds terrible, but it's not. I've had it done myself. And we measure the diameter of the artery with ultrasound before and after that occlusion. So when we release the occlusion, blood rushes back in, and that's the blood being forced through the vessel. And a healthy artery will respond to that by growing in size. And so we can look at the difference between the original size and the larger size, and that is how much it's dilated. The percentage by which it dilates is the FMD. And so throughout the talk, I'm going to be saying FMD. That means vascular endothelial function, blood vessel function, if you will. So why are we interested in vascular endothelial function? Well, it turns out that this FMD, at least in the arm, is inversely correlated with cardiovascular risk factors. So as someone has more and more cardiovascular risk factors, that's triglycerides, high triglycerides, diabetes, et cetera, their FMD is lower in the general correlation. And it turns out that this is also true for the coronary arteries that feed the heart. And it's been acknowledged or recognized since the 1990s that this is a window into the future. Even if you are outwardly healthy, if you have poor FMD, it's an indication that there's something brewing, that you have more of a chance of having vascular problems later in life, heart attack, stroke, atherosclerosis. And so it's been called sort of a barometer of cardiovascular health, even before you've developed the disease. And so some things improve FMD. So if you read in the paper that, things that are good for vascular health, dark chocolate, green tea, red wine, that's what they're talking about. FMD actually gets better. And some things impair FMD, like age, smoking, secondhand smoke exposure, and well, there we go. That's the point of this talk, right? So this is a very good indicator to see whether something is bad for your cardiovascular health if it reduces FMD. And this is based on some seminal studies in the 1990s by Sellermeyer and colleagues, where they recruited a bunch of people, bunch of smokers, bunch of non-smokers, and they measured FMD in each person. And they showed that the smokers had a lower FMD on the average than the non-smokers. It was basically cut down by half. So this was really the first indication that there was a reason for the cardiovascular problems caused by smoking. And notably, the same group came back a few years later, added another group that they called passive smokers. And what that means is non-smokers who are exposed to a lot of secondhand smoke in their lives. Even if they're not being exposed to secondhand smoke right then, they have poor vascular function like that of smokers. And so several years of exposure to secondhand smoke appears to result in chronic vascular dysfunction. Although, as I'll show you in a minute, an individual exposure gives you a temporary interruption. You'll see more about that in a minute. So a quick word about secondhand smoke. When I got involved in smoking research, my interests were less about the person who's smoking and more about the person who is being involuntarily exposed to that smoke. The secondhand smoke was the issue that got me hooked on this. And so it's important to realize that secondhand smoke exposure, we're talking tobacco, causes over 140,000 cardiovascular deaths per year. So we're not talking cancer, we're not talking lung diseases, et cetera, cardiovascular deaths from secondhand smoke. And let's see. I'm sorry. No, I got that screwed up. That smoking causes the 140,000. Secondhand smoke causes about 50,000 deaths per year. And this is mostly from cardiovascular disease. So this is very important because when someone says, oh yeah, smoking, cancer, et cetera, really the big burden is cardiovascular disease. And it turns out that if you have a local smoking ban in public places, then you see a reduction in the frequency of heart attack admissions in local hospitals. So that makes sense. So tobacco smoke exposure impairs FMD, and of course, this is very key to what we're talking about. So we and others have shown in the past that if you expose humans to about half an hour of secondhand smoke, their FMD goes down. And it goes down for about hour or two and then comes back up. Okay. It's transient, but again, if this happens over and over again, apparently it turns into a long-term chronic vascular health problem. And my group also figured out how to measure FMD in rats. And this has been a very useful technique for us because we can look at a population that we know exactly what they're eating. We know exactly what their health is, right? We know they've never smoked before. And so it turns out that even just 1 minute of exposure to secondhand smoke is enough to make the FMD of a rat go down. And then about half an hour later, it comes back up. So we published this way back in 2014. And the message here was that even a brief exposure to real world levels of secondhand smoke is enough to start causing problems with your vascular system, starts to screw it up. You're not going to drop dead or anything, but it starts to affect it. So if you say, well, I'm not going to be exposed to very much, you're still probably having a hit on your cardiovascular system. But in general, it's like, okay, tobacco smoke, everyone knows is bad for you, right? This project might have just kind of stopped there. If it hadn't been for two developments. Marijuana started becoming more legalized and more popular, and e-cigarettes hit the scene. And so these are two examples of things that people look at as potentially or perceived as less harmful or even harmless, less harmful than smoking tobacco. So let's look at that. We're going to look at both of them. Are they harmless? Are they less harmful? Or are they just different? Still harmful, but different. So the marijuana, you can think of it as the smoke without the nicotine, pardon me. And the e-cigarettes, you can think of as the nicotine without the smoke. So two different situations. So let's look at the marijuana first. This all dates back to 2010 when Paul McCartney gave a concert at the Giants ballpark, AT&T Park at the time. You can see I was way out there in the stands. That's real photo of me. And Paul McCartney, I'm going to truncate this. I can go on and on about this, and I used to, but basically, in the middle of the concert, there was a bunch of people started smoking. And I was temporarily surprised because why would, people are not going to let the person next to them start smoking cigarettes. It's just, that's not cool, right? But then I smelled it. It's like, okay, everyone's smoking marijuana, and no one seemed to care about that. And I was actually struck because everyone seemed to be assuming that secondhand smoke from tobacco would be bad for them, but secondhand smoke from marijuana would not. And I was thinking, well, they're both smoke from burning plants, right? Is this really the case that secondhand smoke from marijuana is not a problem? So I realized at the time that even though marijuana was just starting to be legalized in various states, it was still very hard to do this kind of research on humans, but we had this great rat system set up, right? And so we decided to dive in and do a project to see whether smoke from marijuana had the same effect on blood vessels in rats that smoke from tobacco did. So let's talk about what we know about cardiovascular risk from marijuana use, because there's a lot of confusion out there. And part of that dates to this report from the National Academies of Science, Engineering, and Medicine in 2017. Got a lot of press coverage. They were looking at all the evidence for health problems caused by cannabis. And when it came to cardiovascular effects in humans, they determined that there was inconclusive evidence of harmful cardiovascular effects. And you hear people quote this over and over and over again, where they're trying to say, oh, we don't have heart problems because of cannabis. However, this is like right around then, or maybe a year later, all these studies started coming out showing that there were indeed cardiovascular problems associated with cannabis use. And so the American Heart Association actually released a statement in 2020 that said that this was a concern, and they actually showed many studies after 2016, which is when that 2017 report was written, showing, well, I won't go through it, but you can see the list of a variety of cardiovascular problems that were associated with cannabis use. Now, when I say cannabis use, in a lot of these older studies, we don't know whether cannabis use means smoking it or vaping it or vaporizing or taking THC, right? This is a limitation because you're not sure what's causing it. And I'll get back to that in a minute. More recently, 2022 to 2024, a bunch more studies coming out in various journals and conference presentations. And again, I don't have time to go through it in detail, but you get a higher incidence of heart attacks, heart failure, major adverse cardiovascular, cardiac and cerebrovascular events, peripheral arterial disease, increase in the odds of heart attack and stroke, increased risk of heart attack, stroke, or coronary artery disease. I mean, they just keep coming out. And in 2025, as recently as March, a group released a study at a conference doing a meta-analysis. So that's looking at a bunch of different studies by different groups of the same question and determining if all these people's results is the bulk of it showing an effect or not. And this meta-analysis showed a significant association of cannabis use, again, whatever that means, with higher incidence of acute heart attack. The same group published a paper, and I'm not going to show a whole lot of graphs in this study, but in this talk, but I think that this is really an amazing graph. They did a multi-center study looking at results from many different institutions, okay, and showed that in the aggregate, there was an increased risk of heart attack, major adverse coronary events, I think, the risk of dying from any reason, heart failure, stroke, et cetera, et cetera. Look at this, 6-fold higher risk of MI, of heart attack, in cannabis users, double or triple the risk of dying for any reason. It's really pretty astounding. That was back in March. But wait, there's more. It keeps coming. So in May, a group showed that chronic marijuana smokers and chronic THC edible users who are otherwise healthy have impaired FMD, just like that of tobacco smokers. And oh, that's my group. So we just published this, and it's actually gotten a lot of press coverage. You might have read about it. And if you did, I'm happy to talk about it because there's some misinformation already circling around about it. And even more recently than that, in June, a group showed, again, a meta-analysis. So looking at all these other people's studies, in this meta-analysis, they showed marijuana users with almost a 30% higher risk of acute coronary syndrome, that's heart attack and angina, things like that, 20% higher risk of stroke, and greater than double the risk of dying from cardiovascular causes. I mean, these just keep coming to the point that the reporter with whom I spoke at Gizmodo published an article where the headline was, "Yet another study finds weed is bad for your heart." I think that about sums it up. So what about secondhand smoke then? Is secondhand smoke from marijuana really a thing? Well, here's a picture of secondhand smoke. I took this picture at the top on the 420 day several years ago. You remember April 20th when a bunch of people show up at Golden Gate Park and everyone lights up at 4:20 in the afternoon. Um, my the UCSF is about half a mile to the south of this, and we went up to the top of a clinic building, and I took that picture. It's in the distance, so it's greatly enlarged, which is why it's not great quality, but that's not fog in Golden Gate Park. That's secondhand smoke. I had colleagues that went down on the ground the following year. I mean, clearly secondhand smoke is a thing. Now, granted, this is an unusual situation. It's a big festival. It's not the usual situation, but it is the usual situation. And I was floored back in 2017 now to see this in the Chronicle, um, glorifying indoor smoking of cannabis. You know, artisanal weed, medicated spread the new connoisseurs. You know, I look at this and I see the old smoky rooms, the old smoky bars, right? We know not to do that anymore. And yet again, everyone's assuming that this is fine. It's not necessarily the case. And I think that the problem that we've been facing is that people know to avoid secondhand smoke from tobacco and smoking tobacco too. But secondhand smoke, they know to avoid it if it's tobacco. They think secondhand smoke from marijuana is okay. Why? You'll hear, first of all, there's no nicotine. They assume that nicotine is the problem, but actually the main health problem from cigarettes comes from the smoke itself. They said it's natural. It's not adulterated by the tobacco companies, but it's burning plant material smoke. It's medicinal. So this is a kind of a little extra wrinkle that there are legitimate beneficial uses for THC and CBD, but that does not mean that the smoke is not still bad for you, right? But I think most importantly is that no one has said it isn't okay. So for decades, the public health community has been telling people avoid secondhand smoke from tobacco. They haven't been saying avoid secondhand smoke from marijuana because until recently, the evidence just wasn't there. And so people assume that if they haven't heard us say, don't do it, then it's okay to do it, right? So these are what we've been up against. And what I think is very important to realize, and I have sort of a evangelical mission to, you know, to make people see this, that marijuana is more than just THC and CBD. It's THC and CBD and thousands of chemicals that you get from burning plants. And you're not going to be able to read this, of course, but a group did a chemical comparison of smoke from tobacco and marijuana, and basically they found that they're highly similar, with the exception, of course, of nicotine in one and cannabinoids and terpenes in the other. But you're basically inhaling a whole chemistry lab of stuff, of junk, when you're inhaling smoke from burning dried plants, regardless of the source. So we decided to go ahead and do this study. And I love to show this slide because, you know, it was a little scary at the time. It's just more than 10 years ago, and we had to try to figure out how do you get approval to study marijuana, to use marijuana, to have marijuana? How do you get approval from the DEA, et cetera, et cetera? And I love this because this is a real screenshot that I had to deal with as I was applying for my license. And this question I just still cracks me up. Is the researcher human? It's like, you know, how do you answer a question like that? But, you know, whatever I answered, it worked because we went ahead and did the study. So again, hang on. Again, I'm not going to show a lot of graphs in this talk. I prefer to focus on the concept, but this set of graphs from our paper that we published in 2016 is very informative, I think. And in a graph like this, each colored line is a different rat, and we're measuring FMD before they're exposed, after they're exposed, and later than that to see if there's recovery. And we've known that if we expose rats to secondhand smoke from tobacco, their FMD goes down, and then about 30 minutes later, it comes back up. When we did it with secondhand smoke from marijuana, similar levels, it went down, very similar to tobacco, but 30 minutes later, it had not come up. It seemed to take longer. And we did further experiments and showed that, at least in this model, it took about 90 minutes for the vascular function to come back. And there's nothing special about those specific numbers, but conceptually, it seemed that the problem with marijuana was longer lasting with marijuana smoke than tobacco smoke. And it didn't matter whether it had cannabinoids. So even marijuana where cannabinoids have been removed from the marijuana, smoke from that still impairs FMD. compared to air, which does not. So we published this in 2016, and the bottom line messages from that, first of all, secondhand smoke from marijuana for 1 minute impairs vascular endothelial function in rats for at least 90 minutes, longer than impairment from tobacco secondhand smoke. We actually did an experiment where we took the paper out of the equation and we put the marijuana in a screen, a metal screen, just to make sure that it wasn't being caused by burning paper. And indeed, the paper smoke was not required. And like I said, THC was not required. And as a bonus from this project, because marijuana does not contain nicotine, it indicated that smoke that doesn't contain nicotine still impairs vascular function. So the tobacco smoke, nicotine is not what's doing it. Now, we should pause and ask, is secondhand smoke from marijuana really something we have to worry about? I mean, do people really get exposed to it? And the answer actually is yes. So there's been some studies like this one from Colorado, where many children of parents in a smoking cessation study showed evidence of marijuana exposure. Like you can look in the blood for markers that they've been exposed to marijuana, correlating with parental smoking of marijuana in the home. So if the parents were smoking marijuana, the kids were taking it in, okay, and they were showing exposure. A more recent study showed that PM 2.5, those are those particulate matter that in air pollution, you hear about, high particle levels. A colleague of mine measured these particles. It's like wildfire smoke, right? When you've got all this stuff in the air, measured the particles in a cannabis dispensary that allows on-site smoking and found much higher than the highest healthy level, and even the highest hazardous level experienced during wildfires. So when you fire up the Purple Air app on your phone during a wildfire event and find out that, oh, this is like hideously unhealthy air to go out in, I'm getting out my mask, my N95 mask. In the dispensary, it was higher than that. And recently, showing that cannabis smoking in the home is associated with increased odds of exposing the kids to cannabis smoke. And you can see that in stuff that comes out in the urine. So it really is an issue. So when we published these results, there was a lot of, chatter, right? I like to check and see what people were saying on the internet. And I was gratified to see that a lot of people were responding to our results by saying, hey, okay, well, even though it's a rat system, this really is, it suggests that smoke from marijuana could be doing the same things that smoke from tobacco is. So maybe we should avoid smoking marijuana. Maybe we should use vaporizers instead. And at the time, that really meant using something like the volcano vaporizer, where you put dried leaves in a heating chamber, and hot air passes over the leaves and takes the volatile stuff, including the THC with it, into a balloon. So we decided to do this, just to find out if that was really the case. I actually thought that the vaporizer would be fine, but actually it turns out that the stuff also impaired FMD. And I'm going to show another graph because this is really quite interesting. The temperature of the volcano is 185 degrees. That's the range that the volcano is usually set at. You can make it lower. You can get down to the point where the THC does not volatilize. We showed that even under conditions when THC was not released from the marijuana, the aerosol still impaired FMD. Okay, so again, it's not the THC that was doing it in this case. It's something coming off of the leaves, even though there was not combustion going on. It wasn't clear what that was. And in fact, there's an equivalent to these dry leaf vaporizers in the tobacco world. It's these so-called heat not burn or heated tobacco products. The best known is IQOS from Philip Morris. And this is something where you inhale hot air through a rod of tobacco, and the tobacco is still there at the end, but you get the nicotine and other stuff. And I'm sorry, looks like I left something out of that slide. Oh, well, okay, something fell out as I was updating the slides, but basically we showed that it is impaired by the aerosol from this stuff. So not just combustion smoke, but also something that comes off of dried cannabis leaves, dried tobacco leaves when hot air passes through is still impairing FMD. And we published that in 2018. So this has all been rats so far. I'm going to talk about humans, but first I want to turn to e-cigarettes because that is the other category of stuff that people assume are safer. And in fact, Public Health England released a statement several years ago that really floored a lot of us and said 95% safer than cigarettes, which is an absolutely meaningless statement. But you hear that quoted a lot. Okay. And I love this cartoon because this was back during the Uvalde scare, if you recall that. Um, th these things were not highly regulated, right? The FDA has always been one step behind, and the scientists have been one step behind in figuring out what these things are. People are already using them. You can put anything into an e-cigarette. So for that reason, I love this cartoon. So let's talk about e-cigarettes for a minute. Those of you who don't use them might be a little confused because they keep changing. So the original e-cigarette, the first generation, looked like a cigarette intentionally, right? With a little glowing light at the tip. But actually, you were still inhaling the aerosol from heated e-liquid that was inside this fake cigarette thing. Second generation was the vape pen, where you've got a battery and a tank that you fill with your own e-liquid, so you can put your own stuff in there. Third generation was where they got really powerful, and now you could control the power output and all sorts of things. So you can make huge, huge clouds with this. And then the so-called fourth generation was Juul was really the thing that started that, where you've got individual modular pods that you can put into your heater. And they also used a different kind of a form of nicotine salts instead of free base nicotine, which made it actually easier to inhale a lot of nicotine, and people did. So as you probably know, Juul got in big trouble for this and had to majorly pull back. There's actually you could call it a fifth generation now, the entirely disposable e-cigarette, because the FDA clamped down on these things, but it turned out that there was a loophole. And if you had something that was entirely disposable, you use it, you use up the e-liquid, and then you throw the whole thing out, that was not covered by the FDA limitations. And so a bunch of these products are now out there. And just recently, I think within the past month, a group did a study that showed that the leaching of chemicals and metals and things like that into the e-liquid from these disposable devices was much, much higher than in any e-cigarette that we've seen so far, including things like lead and antimony, things like that. So this is a real problem. And so if you think about what is in the cloud that you inhale from an e-cigarette, the people who were advocates for e-cigarettes initially like to say, oh, it's just water vapor. No, it's not. It's the e-liquid is composed of propylene glycol and glycerin. And so you get an aerosol of these things. It's the oily stuff, the nicotine in one form or another, and flavors, which might seem like it's this extra little thing, but actually it's a big deal because each flavor is a chemical. And you got thousands of different kinds of flavors that people use in foods and things like that that are safe to eat, but not necessarily safe to inhale. And a great example of that is the buttery popcorn flavor, diacetyl, um, causing this thing called popcorn lung, which they had first noticed in factory workers where they make popcorn, like microwave popcorn, things like that. They manufacture those products. A lot of those people were coming down with the so-called popcorn lung, which is a progressive disease where your lung just starts to die bit by bit. And it was the diacetyl that was causing that. And guess what the e-cigarette companies were putting in a lot of their e-cigarettes at the time as part of their flavoring mix was diacetyl. So you really have to worry about all these different flavors. But it's not just what's in the e-liquid. When you aerosolize these things, there's a hot heating coil, heats it up, and in the process, you not only have an aerosol of the e-liquid components, but you also have chemical breakdown products from that heating coil. So there are chemical reactions that form formaldehyde, acrolein, bad stuff. You get metals that actually leach from the heating coil into the liquid, metals that you don't want to inhale. And it turns out also in some cases, silicon fibers from the wick, which you never want to have in your lung. Not only do you have the stuff that you're inhaling, but you're also faced with whatever your body is making in response to it, right? It's a second hit. So if your body reacts to the fact that you've inhaled this stuff with some other harmful signal, you're going to experience that too. And a quick word about this EVALI that was a big scare until COVID basically, kicked it out of people's consciousness. But a lot of people, young people who were vaping at the time, were coming down with this really bad, sometimes fatal lung injury problems. And it turned out that this was not nicotine e-cigarettes for the most part. For the most part, it was THC vaping products that were thickened with vitamin E acetate, and that seemed to be the main cause of it. But again, it just underscores that you can put anything you want into an e-cigarette and you don't have to know that it's safe. Big problem. So of course, we decided to use our rat model and study some of these e-cigarette components. And get ready for a bunch of graphs because they all show the same thing. Okay, we published this, exposing rats to just the propylene glycol, just the glycerin, both of them with no nicotine, different kinds of e-cigarettes, Juul, IQOS, tobacco smoke, all of these things made FMD go down, except for air. So at this point, we started thinking, well, this is a little surprising because if this is a problem from smoke, even though you have all this stuff in e-cigarette aerosol, it's not smoke. So why are we seeing this occur? And I actually looked at the whole thing as kind of a detective story. I wanted to figure out what all these things have in common that is causing vascular function to go down. And so, this just sort of summarizes everything that we saw. So in these graphs, each line is a rat, and this graph, each line is the average for each group. That's pretty compelling. So we continued to think about this and thought, well, maybe it's the particulates, right? Because we know that air pollution is bad for cardiovascular health. Maybe it's the particulates. And so we exposed rats to clean dust, basically inert carbon particles that mimicked the particulate phase of tobacco smoke. And that impaired FMD. And we thought, oh, it must be the particles. But we also had planned to do another experiment looking at the effects of some of these noxious gases found in smoke and e-cigarette aerosol, acrolein, acetaldehyde. And we exposed rats to just those, no particulates, nothing else, just those at levels that you'd usually find it in secondhand tobacco smoke. And that impaired FMD. So at this point, I'm pulling out my hair saying, what's going on? This can't possibly be happening. Why are all of these things having the same effect? And so my lab, well, we thought about it for a while and came up with an interesting hypothesis that seems to be true, which is that the impairment of endothelial function from all of these things is not caused by the specific, not caused by the specific thing being inhaled, but is caused by the fact that something is being inhaled that is not supposed to be inhaled. And so airway irritation response appears to be the cause of this. There's a particular nerve that's involved. There's a particular biochemical pathway that's involved, and I won't go into these details. But in general, this is a reason that we've come up with for why so many different things are impairing vascular function, even if they have hardly anything to do with each other. It's the fact that you're breathing stuff you're not supposed to breathe. Okay, I'm going to show one slide about a huge study that we did that actually looked at the heart. After all, heart is in the name of the talk. And one person in my lab did a massive study and I'm not going to show graphs of this because if I did, you'd have nightmares, but he exposed rats to daily single sessions. So that's not all day. It's like smoking one cigarette, for example, daily for 8 weeks to smoke from Marlboro Red Tobacco cigarettes, marijuana smoke from marijuana without the cannabinoids, Juul e-cigarette aerosol, and IQOS aerosol compared to air, and found that all of these things except for air cause problems with the cardiac function, the mechanical function, the heart rate variability, made them more susceptible to arrhythmias, increased the cardiac fibrosis, which is the scarring in the heart, and caused changes in the kind of nerves that were present in the heart in a sort of a more harmful direction. It's the best way that I can say this all in one sentence. So he published that. And this was an indication that it wasn't just the blood vessels themselves. All of these things are having an effect on the heart, and we're not sure why. I don't think we can blame what I just talked about, the airway irritation. We just don't know. So there's more to be learned about that. Okay, well, all of this has been rats. So what about people? We have done a couple of large studies about people. The first of which, and both of these, by the way, have been led by Dr. Leila Mohammadi in my lab. First one was looking at endothelial function, not just in chronic tobacco smokers, but also chronic e-cigarette vapors. Because, we know that smokers have impaired endothelial function, tobacco smokers. And various groups had shown that if you expose people to e-cigarette aerosol, their vascular function goes down. Okay, just like smoking. So we did a study where we had different groups of people who were chronic smokers, chronic e-cigarette vapors who were not smokers, and non-users. And remember this graph I showed you in the very beginning that Celermajer had showed that smokers have poor FMD compared to non-smokers. Well, here's a similar result from her study. If you look here, these are the same groups that Celermajer looked at, non-smokers and cigarette smokers, and it almost exactly reproduces what Celermajer showed. I mean, I was really amazed. It's rare to get such a good result. But notably, the chronic e-cigarette users also had reduced FMD like that of the cigarette smokers. Okay. And in one thing that I'm not sure whether to include this or not, because it's a little complicated, but the when the endothelial cells in the vessel sense the increase in blood flow and they cause the vessel to enlarge, the signal that they produce is nitric oxide. Okay, so nitric oxide being produced by endothelial cells is an important step in endothelial function, and it had been known for decades that if you take blood serum from tobacco smokers and blood serum from non-smokers, and you incubate commercially available endothelial cells. So not from the people. You buy endothelial cells and you put them in a bunch of dishes, and you put on each dish, you put serum from a different person. That the cells exposed to smoker serum would produce less nitric oxide. And so we reproduced that result and showed that serum from the e-cigarette users also reduced the amount of nitric oxide. So it seemed that any way we sliced this issue, the vaping was similar to smoking. And this is not acute exposure. This is chronic use of the product. And I'm not going to shower you with all of the graphic results from this experiment, but to summarize another part of the test that we did, if we looked in the blood of each person for circulating proteins that indicate cardiovascular risk, pro-inflammatory proteins, pro-clotting proteins, et cetera, we saw something interesting, that the smokers had an increased level of some of these markers of risk. Vapors had an increased level of other markers of risk. Sometimes both of them had it, but there were some that were only in smokers and some that were only in vapors. This is really interesting because even though both smoking and vaping seem to be impairing FMD, it means that if you do both of them, you might actually be getting the worst of both worlds, right? You might be elevating the harmful markers of both types. And this is notable because dual use is a major issue right now. Think about this. When someone decides to smoke marijuana, they're not usually switching from tobacco to marijuana. It's a completely separate thing. But when someone starts vaping, it's usually one of two different sorts of person, either an impressionable teenager who's doing it because they think it's cool, but frequently it's older people who are switching from smoking. They're trying to quit smoking. And so they will switch from smoking to vaping. And if they don't switch all the way, they think, okay, well, at least I'm not smoking as much. I'm vaping, but I'm not smoking as much. You're still now getting two potentially harmful things instead of one, right? So dual use might be worse than single use of either. And the message there, and we can't prove this, but what it indicates is that if you're switching from smoking cigarettes to vaping e-cigarettes, you should do it completely, right? You're going to have the best chance of a benefit from switching to vaping if you just completely cut out the smoking and only vape. So we published this in 2022, and I'm going to spend the rest of the time on the study that I briefly mentioned before, and I think, we're doing well timing-wise, just a few more minutes left. This is a study that we just published last month that I mentioned about marijuana users, and we call this the CANDIDE study, Cannabis Does It Damage Endothelium? And this is the growing clinical team doing it. Again, Layla Mohammadi is the clinical lead on this. And what we showed is, and this is the paper that we actually published last month, was that chronic marijuana smokers and chronic users of THC edibles both had endothelial dysfunction. It doesn't prove that these caused the endothelial dysfunction. We can just conclude that there's an association, but we thought that this was very notable. And so in the CANDIDE study, ultimately, we want to be able to report on the following groups: the cannabis smokers, people exposed to secondhand smoke from cannabis, THC vaporizers, THC edibles, compared to tobacco smokers and non-users, right? Some of these groups are harder to recruit than others, like the secondhand smoke group. Really hard to find people exposed to secondhand smoke from marijuana who are not using any of these other things. So we didn't have enough of some of these groups to include in our study that was published. What we did do is we looked at the chronic marijuana smokers, the chronic edibles users, and compared them to the chronic tobacco smokers that we had studied before. And so the marijuana smokers were defined. So everyone is otherwise healthy. That's important. Some people have tried to say that this is a weakness of the study, but no, this the point of the study is that everyone is healthy outwardly. We're looking for signs of increased risk in the future, right? Nobody is over age 50, because when you start to get over 50, sorry to say, as someone who's over 50, you start to accumulate various health problems that can confound such a study, and we didn't want any of those confounders. The marijuana smokers have defined by at least 3 smoking sessions per week, not 3 joints per week. Sometimes you smoke part of a joint, you put it away, you come back the next day and smoke more. 3 smoking sessions per week. The THC edibles users were people who didn't smoke anything, didn't vape anything. They took at least 3 THC edibles per week. And then the non-users, none of these people are tobacco smokers. None of these people use any of these other things. It's a very, very clean study. And this, you don't have to look at all of this stuff. The reason that I'm showing this is for anyone out there who's been hearing about this study, because like I said, it got a lot of press coverage, SF Gate, and Quidline even. A lot of people have been talking about it. And a criticism that comes out is, there are 2 criticisms. First of all, it's a small number of people, 55 people total, but it was a very clean study. We're very picky in terms of the kind of person we recruited. So even though it was a small study, the statistics were very robust and the results were clear. But we've been hearing criticisms like, oh, they didn't control for body mass index or blood pressure, things like that. And I show this just to point out that the 3 different groups were very similar blood pressure, very similar BMI, right? This basically says that not having controlled for those things should not make a difference, because the groups were very similar. And so here's what we showed. It was actually a very straightforward, short and straightforward report. In flow-mediated dilation, FMD, first look here, the marijuana smokers had FMD, roughly half of that of the non-users. You've seen that before. This is exactly what we and others showed for tobacco smokers. It's what we showed for vapors. Very similar effect. We were surprised. I was surprised. Dr. Mohammadi was not surprised. I was surprised that the THC edibles group also had poor endothelial function. And we had already shown that THC is not required for smoke to impair FMD. So it's like, whoa, that's weird. But for some reason, the THC users were also showing poor vascular function. We looked at arterial stiffness and saw there was no change in arterial stiffness. Now, remember that experiment that I told you about a few minutes ago about cells being exposed to serum and the effects on their production of nitric oxide? This was very interesting. Again, look at the marijuana smokers compared to the non-smokers. And it's, again, what we've been showing with everyone else, that serum from the marijuana smokers caused cells to produce less nitric oxide than serum from non-users. But the THC edibles users, even though their vascular function was impaired, their serum was unaffected, or at least it did not have this harmful effect on cells. So both groups had impaired endothelial function, but it seems to be for different reasons, right? Very interesting. And the last thing I'll show is that there seems to be a rough dose response correlation. You don't really have to look at the details of the graphs, but that the bottom line is that the more times per week a smoker would smoke marijuana in general, the worse their FMD was. And even though there was no correlation between the number of times someone took THC edibles and FMD, if you looked at the total amount of THC used per week, the more THC someone used, the worse their FMD was. This tells us two things. First of all, the effect that we're seeing is real, okay? Because you can see as you change one, the other one changes. But maybe for public health messaging, an important note is that we're not saying that, oh, if you do anything of this, you're having a terrible effect on your health. We were looking at people who used at least a certain amount per week, right? And since the less they used, the better their FMD was, you can probably extrapolate that and say, well, so if someone is using this stuff rarely or moderately, they might not be experiencing the effects that we've seen. So I just, I don't want to be overstating what we are reporting. Okay. So let's summarize everything, and then I'll take some questions. It's 2 slides of summary. So in rats, FMD is impaired by brief exposure to smoke from tobacco, smoke from marijuana, aerosols from IQOS or vaporizers, or e-cigarette. The impairment of FMD from this acute exposures in rats does not depend on specific constituents, but just on the fact that the rats were inhaling something. Okay, and it seems to be a result that involves a particular nerve in a particular biochemical pathway. If in the heart, in rats, 2 months of daily inhalational exposures to tobacco or marijuana products of all those different sorts, it impaired cardiac contractile and electrophysiological function and increased scarring, fibrosis. In humans, FMD was impaired similarly in chronic tobacco smokers and chronic e-cigarette users. The endothelial cells release of nitric oxide is impaired by serum from both chronic tobacco smokers and chronic e-cigarette users. The chronic tobacco smokers and the e-cigarette users, however, have different subsets of markers of risk circulating in their blood, so dual use could be a problem. FMD, but not arterial stiffness in humans, is impaired in both the chronic marijuana smokers and the chronic THC edibles users. And the reason I've got this little asterisk here is because a colleague of ours in Canada did a similar study and found actually the opposite. In that study, FMD did not go down, but arterial stiffness was adversely affected. And we talk about this a lot, and we're trying to figure out, okay, what accounts for this difference? But in both cases, there were vascular problems associated with the marijuana smokers. And lastly, the endothelial cell release of nitric oxide is impaired by serum from the marijuana smokers, but not from the chronic THC edibles users. So the problem that seems to be occurring with vascular function in both of these groups appears to be happening for different reasons. Bottom line, breathe clean air. That's pretty easy to say, right? So I'm going to quickly acknowledge my lab. We can't talk about everyone individually, but the people currently in the lab, people who have been in the lab, who have participated, collaborators, funders. You can see here we are very, very serious about everything we do, including cutting cakes. And if you want to know how the patient did in this, well, the patient survived, and then we ate the patient. So with that, I'm going to stop sharing my screen, and I'm happy to take questions.
Matt, I see 3 questions. The first question is, does third-hand smoke impairs FMD?
I'm sorry, you could say that again?
Does third-hand smoke impairs FMD?
Oh, it was a good question. Someone out there knows their stuff. So third-hand smoke is the name given to the chemicals from smoke that stick to walls and rugs and furniture, and later are released back into the air. And it's responsible for that musty smell when you go into a hotel room that obviously someone's been smoking in. That's the smell, it's the stuff coming out. And babies who crawl around in rugs in homes sometimes will absorb nicotine into their bodies simply by virtue of that third-hand smoke. So does it impair FMD? Well, people ask us that every now and then. We have not done that study. I think we should, but we haven't done it yet. And I would guess the answer is no, because it seems that the effect that we've been seeing mostly is caused by the inhalation of stuff, not necessarily the absorption right through the skin. So I can't answer the question definitively, but my guess is that third-hand smoke would not have this effect. This doesn't mean that it's not harmful. I mean, clearly you're getting chemicals that you don't want to have, but the specific effect on vascular function, probably not.
Thank you, Matt. Another question is there any significant statistical difference in FMD regarding mentholated and non-mentholated tobacco products?
Pretty good. So believe it or not, I can actually address that. In the beginning of that detective story that I was talking about, when we were trying to figure out what components of smoke were affecting FMD, we did a study where we got special tobacco cigarettes from the NIH, where they were in general the same cigarette, but some of them were regular levels of nicotine, some of them were very little nicotine, and some of them were kind of regular low levels of menthol, and others were more like menthol cigarettes. And even though the smoke from all of these things impaired FMD, we saw a slight difference, whereas the smoke that was low nicotine didn't impair FMD quite as much. And the smoke that was high menthol did not impair FMD quite as much as the regular menthol cigarettes, the regular levels of menthol. But everything impaired FMD. And it's very important not to take that result and think that menthol is a good thing, because menthol has other problems associated with it. First of all, menthol actually slows down the metabolism of nicotine. So having menthol there can increase the time that nicotine spends in your body. And then again, it's just another thing that hooks people on cigarettes. There are certain populations, especially that are especially susceptible to being hooked on cigarettes by menthol. So I always put that caveat in there because I don't want someone to listen to this sort of very narrow experimental evidence that menthol cigarettes weren't having quite as bad of a problem as non-menthol cigarettes. I don't want people to run off with that and say, hey, everyone use menthol. So hopefully that answers the question.
Thank you, Matt. The third question is, so if in your lifetime, you were never a smoker, but lived at various times with a smoker as your spouse, do you need to inform your primary care physician to get a referral to see a cardiologist?
Well, no, I mean, I think that when you're talking with your doctor, and in fact, you know what, let me share my screen again. I want to show, oh, hang on a sec. I want to show something that I've shown in a previous, so now you're saying all my other talks. Let's see, this was shown here. I'm actually going to show a different, oh no, that's the wrong one, sorry. Where is it? Let's see, it's going to be in talks. I think this will be very useful. Okay, here it is. Oh, goodness. Yeah, I did. So I gave a talk for a gathering of physicians and other medical professionals. And in this, I started off with this slide saying, when you doctors are
You're not
talking.
sharing your screen yet, Matt.
Oh, I'm sorry. Wait. Thank you for that. Oh, my stuff is, okay, where did Zoom go? Okay. Okay, can you see it now? You can see that?
Yes, I can see your screen.
Okay. So this was basically saying the doctors in the room is saying, when you normally would ask your patients if they're smoking, make it, are they smoking anything, right? If you were normally asking, are you avoiding secondhand smoke? Turn that into, are you avoiding secondhand smoke from anything, including cannabis? And add to it, are you vaporizing cannabis? Are you vaporizing tobacco? Are you vaping e-liquids. And the reason for this is that I think all of these things potentially impact cardiovascular health, including the secondhand exposure. It doesn't mean that you have to worry that you have cardiovascular disease as a result of it, but I think that for your general doctor, not even just a cardiologist, but your general physician who's assessing your overall health, it's worthwhile if they know that you have a history of being exposed to secondhand smoke. It might make them more willing to, or more likely to, order particular tests just to make sure that you're not facing some kind of early disease signs. Okay, I'll stop the share if I can. Okay. Hopefully that answers the question.
I see. Thank you from the audience. That's the last question we had from the audience. So
seeing some chats. Oh, okay. That was one of the other questions, I think.
Yes. Yeah.
Okay.
Yes.
Okay. Good.
So,
well, thank you for your attention. Look at that. It's 3 o'clock on the dot. So that.
oh, there's one more question.
Oh, okay.
The question is yes or no. It's vaping safer than smoking cigarettes.
Oh, yeah. See, I got to be very, very careful about how I answer that because it's hard to just boil it down to that simple thing. I think it's more useful to ask is it safer for one particular situation than another? In aggregate, I would guess that if you only vape and don't smoke versus only smoke and don't vape, you're probably better off with the vaping. But as a colleague of mine used to say, it's kind of like asking what's worse, jumping out the 20th story of a building or jumping out the 4th story of a building. The vaping is better, but the vaping still causes problems. So it's important. So, okay, so I will say, yeah, I think that vaping is, exclusive vaping is probably safer, probably safer than exclusive smoking, but it's important not to conflate the concept that something is less harmful with the concept that it's harmless. And so I think this is very contentious in the field. Even, researchers, smoking researchers, some of them are more sort of in favor of using e-cigarettes as a smoking cessation than others. But I think there's a general consensus that what to say to the public is don't smoke, okay? If you have to use nicotine, it's better to do it by vaping than by smoking. If you do that, only vape, don't smoke at all. And it's still better just not to do either in the first place. So you can step down that way.
Thank you so much, Matt. Don't see other questions in Q&A or chat. With that, I'd like to thank you for the great presentation. Your insights on the link between smoking, cannabis, and heart health were eye-opening, and we've learned a lot today from you. I also want to thank everyone in the audience for joining us and for your thoughtful questions and engagement. I hope that you leave here with a better understanding of the best cardiovascular risk involved and the implication for both individual and public health. As a reminder, I'll be sending you a follow-up email with the recording link and Matt's slide deck and a short feedback survey. We love to hear your thoughts. Take care, everyone. I hope to see you at another library program soon. Have a great rest of your day. Bye-bye now.
Thank you.
Thank
Bye-bye,
you.
everybody.
Bye.